Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and today I'm going to talk about a little bit of a controversial topic, at least in the ENT world, and that is how strict do you need to be with water precautions after having ear tubes placed. And so when we place ear tubes, we're making a little tiny hole in the eardrum, and there's a little rubber or sometimes metal tube that is holding that hole open, kind of like a stent. And that tube will usually be there for about a year, and then it falls out on its own and the eardrum hole closes, hopefully. But during the time that that hole is there and that tube is in place, how strict do you need to be with water getting in the ears? The reason we have any concern about that is water can carry bacteria, and water can just be uncomfortable to get into the middle ear space. And so I'm talking about the space underneath the eardrum. So in a normal person, that the eardrum is a watertight barrier and no water can get into that middle ear space. But in people that have either a perforation or a tube, water can get through that perforation or tube and into the middle ear space. When water gets in there, it usually hurts and stings. So I'll have parents come in and say that have tubes and their child was in the bath and they got some water in their ear and it really burned and they were crying for 10 or 15 minutes or so. And so water can cause an infection if it gets into that middle ear space because it carries bacteria with it. And so how strict do you need to be? Well, soapy water is actually more likely to get through a tube than pool water. Soapy water, because of the surfactant of the soap, is caused something called surface tension to relax. It can allow water to get through a tube or a perforation a little bit easier. So although it's not typically that harmful to get the water under the ear, it could be uncomfortable. So if kids like to submerge their ears in water during bathing, it's probably a good idea to wear plugs. If you're just bathing your child or yourself and water's flowing over your head with a shower or such, then you probably don't need to worry about it. But I wouldn't squirt water in the ear, or I would try to be a little bit cautious about getting water in the ear, but I wouldn't put plugs in routine cases unless the kid or the patient wants to put their ears under the water. In swimming, there's been a lot of studies done about this, and actually the studies really don't show that much of a harm in swimming without plugs in place. There may be a little more likelihood for an infection, but it's such a low likelihood of worsening, and the infections can usually be handled fairly easily with drops, that it may not be worth the trouble of wearing plugs all the time just to prevent that unlikely opportunity the pool water is going to cause an infection. My routine has been telling people that if their child wants to really dive under the water or get submerged under the water, to wear plugs, but to be frank, I'm not sure that that's totally necessary. In lake and ocean water that carries a lot higher bacterial composition, I think it probably is a good idea if you're submerging your head underwater in the lake or in the ocean to wear some earplugs, although I don't know that the studies totally can back me up on that. But that's my belief just based on that non-chlorinated water and the bacterial composition that it contains. So in summary, in the bath, I probably wouldn't worry about plugs. Even in the pool, you probably don't need to worry about plugs in most children unless they really want to be diving or swimming underwater, and if they're getting a lot of pain from water getting in the ears and causing problems. Now, if the child is having recurrent bouts of drainage in a child who has ear tubes in place, okay, that's a different story. Maybe we need to do everything we can to prevent every last infection, so I might be a little more strict. In lake and ocean water that's going underwater, I would really prefer plugs in those patients. So hope that helps. It's a little bit of a controversial topic, and different doctors are going to give you different opinions, but that's my opinion. Thank you.